Thank you for that nice introduction. After a wonderful oration by my elder sister Anuja, now I am going to discuss a very interesting topic: male obstetricians in obstetric practice, pros and cons. I bring greetings from Omega Hospitals Nagpur, along with the team of my directors, Dr. Manisha Shembekar, Dr. Ashish Zararia, Dr. Kalpana Jetha, Dr. Rucha Thakre, and Dr. Shantanu Shembekar. So you can see that we have already started following gender equality in our hospital. We have 3 male directors and 3 female directors. My special thanks to Dr. Poonam Verma. I have been associated with Dr. Poonam since last 25 years, and I always love visiting MJMS Sevagram. Thank you, Poonam Madam, for giving me this wonderful opportunity. Disclaimer: this topic is based on gender preferences in the field of OBGY. During next 20 minutes, I will try to put my point of view. But please do not misinterpret it as a sexist remark because I do not intend it. And I would like to narrate my story as well to make it interesting. So please allow me to do so. जंगल जंगल बात चली है, पता चला है, गायनिक में एक फूल खिला है. That was a popular Mowgli's song of 80s, and these precise words were written on the notice board of GMC Dean Office of GMC Nagpur by a few pranksters when I took admission to this course. I had become the topic of discussion. Everyone gossiped in hush hush tone, but it was the year of 1992, and with only a handful of male gynacs, and Dr. Bangal sir is with us. He was also attached to GMC Nagpur as a resident. So only few gynacs were there. So such reaction wasn't totally unexpected. Life wasn't hunky dory at the department, as my colleagues felt awkward, and teachers were also not very comfortable with male students. Some girls they despised me as they felt that I had snatched their seat. यही बंदा है जिसने मेरी सीट खाई है. ऐसे मेरे को बहुत लोगों ने बोला है. But boys from other departments, boys being boys, they envied me due to the fact that I was constantly surrounded by girls, roaming around with them in cafes and corridors without any inhibition. And even today, I am so lucky that today also I am surrounded by girls. So that is how it is. But I must agree that I was pampered by the teachers as well as my colleagues, because after all, people in minority get few advantages. After completion of my PG, when I started my clinic, my guide asked me, Dr. Burtu madam was my guide, and she was a very nice lady, kind hearted, and typical Kashmiri Pandit. And she used to treat me like a son. तो उन्होंने मुझे पूछा, बेटा गायनिक की प्रैक्टिस करते हो या जीपी करते हो? पेशेंट्स आते हैं तुम्हारे पास? And after watching Dr. G, I realized that even today, many people still think that way. So why this topic? Because he and she cannot be separated. WHO, Government of India, MGMS Sevagram, everybody wants gender equality in obstetric practice, and that is why we all are discussing this topic. Now, the point which was added in my topic was, is it a choice or a compulsion? And I think even today, OBGY remains the most sought after branch, as you all know, and the question of compulsion does not arise. So when I talk to the budding doctors, young male gynacs, they always say that we are genuinely interested in this field, and that's the reason why we have come here. Amog is with us, a young budding gynecologist. He also has taken this branch by choice. So it's always by choice for most of us. If you ask me, I always wanted to become a gynecologist because this was my dream branch. The subject is interesting to start with, and it requires person to make quick decisions and act swiftly. So what you need is speed and precision. That is what is important in obstetrics. And the most important thing is managing 2 lives, which is a Herculean task. Nowhere except in obstetrics, you have to deal with two lives. And that is the beauty of this obstetrics branch. And that is what makes this branch a special branch. I tried to Google that how many boys prefer OBGY in India. And this is what is AI overview. It says that is difficult to pinpoint, but the general trend indicates decrease in the proportion of male gynecologists as compared to female gynecologists. So that is very clear. We all know this, and that is the reason why Poonam madam has allotted this topic to me. Once when I started my clinical practice, once my aunt asked me, मराठीमध्ये आम्ही त्याला म्हणतो अगदी बाळबोध प्रश्न होता की चैतन्य, हाऊ कॅन यू ट्रीट समथिंग दैट यू हैव नेवर एक्सपीरियंस्ड? आई सेड, अरे किताबों में तो सब कुछ लिखा है, जैसे लेबर्स पेन्स को एक्सपीरियंस करना जरूरी थोड़ी है. लेबर की मैकेनिज्म तो किताबों में लिखी है, वो पढ़ के हम लोग लेबर तो कंडक्ट कर ही सकते हैं. और हम लोग एम्पैथी रखते हैं ना, एम्पैथी तो है हमारे पास जो हमेशा काम आती है. सो दैट वाज द बेसिक क्वेश्चन. बट द बिग क्वेश्चन behind this basic question is, do females are less empathetic? Because they have gone through the same ordeal and they feel that it is all normal. What's the big deal? अरे डिलीवरी में दर्द तो होना ही है, हमने भी सहन किया, तुमको भी करना पड़ेगा. While male doctors are more supportive. I have to leave this answer to your discretion. लेकिन जिन्होंने ललिता पवार की फिल्में देखी होगी, वह मेरी बात को अच्छे से समझ गए होंगे, क्योंकि सास भी कभी बहू थी. Yes. And another question is, do male obstetricians are more skillful than females? And are they good in handling crisis and emergencies like PPH and shoulder dystocia? To some extent, I think the answer is yes. A YouTuber, Surakshit Batina, he made a video. He wanted to get the public opinion about what are the preferences in as far as public is concerned. So he asked one question: will you go to a male gynaec? And he got interesting answers. Some were funny, some were hilarious, and some were illogical. Few answers were awkward also. So many people said that they are more gentle, they are more patient. I will always prefer male gynecologist. Somebody said that initially there was a hesitation, but once you go, you have no problem. But some have said that I will never go. I cannot imagine going to a male gynecologist. And someone has said that I did not like the approach of a male gynecologist. This is a very important answer. So there is something called as male touch. तो यदि आपको जरूरत पड़ती तो क्या आप मेल गायनिक को कंसल्ट करोगे? और यही सवाल डॉक्टर जी के हीरो ने पूछा था उसके गाइड को, और उन्होंने आंसर दिया, यस, इफ यू आर अ कॉम्पिटेंट गायनेकोलॉजिस्ट, I will definitely prefer to go a male gynecologist. So competency is what matters, not the gender. So issue of male touch is important. If you happen to watch this Dr. G, there is one scene where Shefali Shah says that a doctor is a doctor. There should be no distinction between a man and a woman. And practicing since last 29 years, I can say that I have seen a positive change in the outlook about this issue. There is definitely a positive change, and now people don't think like that. And in India, anyways, we are not allowed to examine a female patient without a female attendant. So you need to have a female attendant, that is compulsory, so the question does not arise. Taking this discussion forward, male obstetricians, they are working in labor room, they do PV examination, they do vaginal deliveries, they do C-sections. So the question is, do female patients allow male gynecologists in labor room? We are talking about labor room. And the answer is yes. Even 33 years back when I joined department, patients were very comfortable with us in the labor room. In fact, they feel more secure, as if they have a big brother around taking care of their well-being. So that is what I have experienced. But there was some problem outside labor room. Though no problem in labor room, outside labor room, there was some level of discrimination which was there. There were few awkward situations also. And seniors were not very happy. Sometimes they used to think that they were not happy with the fact that boys are joining this department. And often they used to express this feeling while talking amongst themselves. And after passing my exams, I was denied job in the trust hospital for my gender. Many seniors, they refused to call me for assisting surgeries as they were worried that patients might object. A senior consultant told me that her patients would feel uncomfortable with a man inside the OT. So I was left with no choice but to start my own clinic. और वहां पर भी मुझे देखकर पेशेंट्स वापस चले जाते थे. इट वॉज क्वाइट फ्रस्ट्रेटिंग. एंड देन आई डिसाइडेड, खुद ही को कर बुलंद इतना, खुद ही को कर बुलंद इतना कि हर तकदीर से पहले खुदा बंदे से खुद पूछे, बता तेरी रजा क्या है, बता तेरी रजा. सो fast forward to this day, by the grace of God, we are a team of 15 gynecologists working at our center. Three, as I told you, 3 out of 6 directors are male. Patients insist that I should examine them. So the situation is definitely changing. It is the goodwill of you all, patients and everybody, that we are now changing. The scenario is changing and we are experiencing a good change. If you just compare the poor and rich or rural and urban divide, I realized that surprisingly, rural class accepted male gynecologists very quickly, particularly in Maharashtra, our state. Tier 2 cities, people still have some inhibitions. And there is a problem, definite problem in north as well as southern states of our country. But Mumbai and Kolkata have always and always been male dominated. We all know that there are so many पुरंदरे से लेकर के CN पुरंदर से लेकर के BN चक्रवर्ती तक, so many male gynecologists are very well known all over Mumbai and Calcutta metros. But I think the trends are definitely changing, and there is a transition from male dominated society to a female dominated society. So nowadays the society is female dominated society, and most of the women, they patient, they do not think about the gender, but they think about the best doctor. Partners also respect their decisions. Parents who belong to senior generation have no choice but to listen to them. But still, I must say that they are also comfortable with male gynetics. And when it comes to surgical procedure and emergency management, many patients prefer male gynetics. But the bottom line is, although more boys are opting for OBGY, it largely remains a female dominated branch. What is important is passion and love for your job. At the end of the day, this is what matters, be it a man or a woman. As residents, we had fun working together, delivering babies at 2 a.m. and then having a cup of tea with Parle G at a small Maushitsa canteen in front of our labor room. So those were the best days of our life. Now the most important question is it so that obstetrics is made for men and not for the women? This is a twist in the kahani. Kahani mein twist hai. So I am going to ask you this question, whether it is a branch which is made for men and not for women. You will wonder why I am saying this. But after discussing various situations like odd working hours, infinite stress, managing 2 patients at a time, nothing against women, but don't you think men can handle this situation in a better way? Maternal instincts are always there, and women are always, their priority is always a family. So there is a distraction at workplace, there is family pressure, kids, physical capacity, ability to handle stress, and all these things that take a toll on women's health. In fact, many women are unable to focus during their working hours. Men being primary breadwinners, they are always more focused and less emotional, and that gives advantage while handling the crisis. So friends, maybe obstetrics is not a good branch for women, particularly in this era of litigations and high expectations. But wait, just wait. I am not coming to the conclusion. Do not jump to the conclusions, because we are here to discuss pros and cons, and we should not be biased for any gender. So we know that men are for Mars and women are for Venus. Men have different qualities while women are different. But at the end of the day, everyone tries to deliver the best. So we know that we work for our patients and we deliver the best as far as our patients are concerned. Obstetrics is not a one man or a one woman show. It is always a teamwork So we always should work together, and we should always try to get the best out of both the genders, because every person has something unique, something different, and you should try to get the advantage of this quality. If you look at the studies have said that it is a female dominated branch. There is a feminization of the department of OBGY, and this is to some extent true. Even in India, men, they are suffering, because in 2016, Rajasthan government issued an official order which caused ruckus. Only female gynecists can conduct examination of a female patient. That was the order, which was then there was a protest, and then it was taken back. In 2020, in Uttar Pradesh, in a rural hospital, one male gynecologist conducted delivery, and ASHA workers, they protested because they said that we don't want a man to conduct vaginal delivery or delivery. So there is some problem, and time has come that we need to change this scenario. The male gynec number is going down, and we need to do something so that we get gender equity as far as OBGY branch is concerned. So on this platform, I see very few boys here, but I appeal that more and more boys should join this wonderful specialty. And if someone asks me कि अगले जन्म में तुम क्या बनना चाहोगे, तो मेरा आंसर तो यही है कि मैं तो gynecologist बनूंगा. So friends, does sex matter? Not at all. Not at all for the present day youth. We all are born as human beings, and together we can and we will work in the best interest of the society in general and laboring women in particular. जाता जाता कविवर्य बासी मर्डेकरांची एक सुंदर कविता मी तुम्हाला ऐकवणार आहे. पोर सवदा होतीस काल परवा पावेतो. पोरा सवदा होतीस काल परवा पावेतो. होता पायातही वारा काल परवा पावेतो. मतलब कल तक तू एक छोटी बच्ची थी. आज टपोरले पोट, आज टपोरले पोट जैसे मोगऱ्याची कळी. कितना सुंदर वर्णन किया देखो. पडे कुशीतुनी पायी छोट्या जीवाची साखळी. मतलब आज तू तेरा प्रेग्नन्सी है और आज तुझं पोट टपोरलं आहे आणि जसं काही मोगऱ्याची कळी फुलते आहे. सी शब्दांकन पहा किती सुंदर आहे. पोर सवदा होतीस काल परवा पावेतो. थांब उद्याचे माऊली, थांब उद्याचे माऊली. तीर्थ पायीचे घेतो. मतलब उन्होंने कल जो माँ बनने वाली है उसको भगवान का दर्जा दिया है, और ये बहुत बड़ी बात है. दिस इज द लेवल ऑफ रिस्पेक्ट वी ऑल मस्ट गिव टू आवर लेबरिंग वुमेन, एंड दैट इज आई थिंक what we all are here for. We should and we must and we all respect our laboring women, and let us hope that after 10 years this topic will be irrelevant. So thank you all for patient listening, and thank you Poonam madam for this wonderful opportunity. Thank you.